was at the opening of Craigwares, remember?
Yeah.
Remember that? You still look beautiful.
Dementia affects the brain's ability to control the whole body. So gradually all of the functions of the body shut down or start to break down. So we often see people lose their appetite and their thirst, so they can get dehydrated. Or their ability to control their swallowing becomes difficult. Now, medical science has the ability to treat these problems. We can put drips and lines into people, we can put tubes down people to feed them. The question is, are these interventions helping people? Sadly, we know that from studies that have been done that many of these interventions don't help. So it's important for the families of patients who are suffering from dementia to be able to decide whether they want to have these treatments, whether these treatments are worthwhile for their relative. So it's important to think about what are the options for treatment in advance, and if possible record that in an advanced care plan.
It wasn't something that Mum had ever discussed. There was never any, she wasn't prepared to talk about what was going to happen in the future. And so that did make it, incredibly hard. And when I did try to talk to her about it, it was just, it brought up a lot of frustration, a lot of anxiety. So it really wasn't worth going down that track. And so it was really up to myself to make a plan for Mum and make the decisions myself.
The benefits of advanced care planning, from my perspective as a nurse, and the goals of care are primarily around focusing on the individual. Now, while many people haven't been able to tell us what they want in terms of care and treatment, it's been a taboo subject for families. No one wants to talk about or focus on that nasty point of life or that end stage of life. We need really to get down and sit with families and talk through what's important. And by doing that, we can focus on what their values are, what the person, as we know or understand, what their wishes might be. Have they ever made any statements? And how do we draw from that what their values are in their life? And how do we act in their best interest to determine what care they should be receiving? The responsibilities of the substitute decision maker are primarily to put themselves in that person's shoes, to try and speak for the person who's now not able to speak for themselves. And if they don't know what the person would actually be saying or what they would want, or if they've never had that discussion, then they may need to just really focus on what are the best interests of this person, and that you can get an idea of what that might be by getting other help from other health professionals, doctors, nurses, facility providers, service providers. They can provide support and assistance in that. Another thing that might assist them is to get another opinion so that decisions can be made in the best interests of the person.
It wasn't as traumatic as what I had expected. It certainly wasn't as emotional as what I expected. And then I thought to myself at one stage, am I being a little bit heartless in being so strong about all of this? But it wasn't hard, and it was put my mind at rest, and I felt really good. And I felt it enabled me to, if I did go overseas, if I was away on holidays, if something was to happen to Mum, that everything that was organised for her.
For someone who's lost decision-making ability, when it comes to medical and dental consent, we as health professionals need to get consent from somebody else. And in New South Wales, that person's called the person responsible. Now, the person responsible is basically a hierarchy of people that we need to go through in order to determine who can provide that consent. So the order is that we look for is there an enduring guardian or an appointed guardian? Is there a spouse? If they don't have a spouse, is there a carer? And if there's no carer, then any other relative or friend with a close and continuing relationship with the person. Now obviously this can be many people, it may be several siblings. So we do ask families to try and identify one person who would act as the person responsible to provide that consent should it be required. The goals of care for someone with dementia really vary on the stage of the illness that they're at. For someone in the advanced or the terminal phase of the disease, often we focus on what we call a palliative approach. And while we recognise that they're not going to probably die in the next couple of days, it might be a year or a couple of years before this person actually does die. So what we want to do is try and get a balance on alleviating or minimising negative symptoms like infections and discomfort and pain, but also maximising their positive experience. We call it a low-tech, high-touch approach. So in order to help families work through this, I guess if we can ask a little bit about what were their values in life, what was important to them, what were their spiritual values, and by that I don't just mean religion, but some people are from a religious tradition. So those sorts of conditions and thoughts need to be taken into account. The other thing to look at might be how did this person, if they've lost that decision-making ability, how did they approach other important decisions in their life? How did they approach, say, other milestones when they married, when they had families, when they, had parties? Did they go around and get a whole lot of important information and see what everybody else thought, or did they say, no, this is the way it's going to happen and this is the way I want it to be? So some people can be very dogmatic and other people can really want everyone else to be on the same page and in agreement about these things. The sorts of things we might include in an advanced care plan or plan of care, it's called different things in different places, are basically the sort of elements around CPR or cardiopulmonary resuscitation. We know from medical evidence that patients with advanced dementia and those with advanced age and other chronic conditions often don't survive cardiac arrest. So it would be seen that those sorts of treatments might be deemed as not appropriate for the person. So we make that decision. The next thing we might look at also is the aims of care. It's not a specific refusal of certain treatments. We'll still require to get consent from the family if the person does become unwell. So do they require to go to hospital? Do they need to have IV antibiotics if they have symptoms that need sort of closer management? There are those sort of specialist services that can be assisted.
Thinking about advanced care planning, I think you need to talk to people that have some understanding of it. So I spoke with my GP and I spoke with Mum's neurologist, and I just felt with getting all the information from them, and I read a lot about Alzheimer's and to learn what was happening in the different stages. I think once you realise that they aren't going to get better and this is a terminal illness, and accept that, then you need to put something into place.
People can struggle endlessly with this about what the right thing to do, what the right treatment for the person they're looking after is. It can be very hard to decide, and this is where consulting with the doctors and nurses and the rest of the family about the right treatment and framing it into either an advanced care plan or a plan of treatment really can lift off a lot of this burden and make it that little bit easier for the carers.
I see families who are in really difficult and dire straits positions. They haven't made a plan, the person hasn't made a plan, they haven't sat as a family and talked these things through. So when the person becomes unwell, the default position is to go full steam ahead, don't ask questions. And we've got a health system that's great at doing that, but we never stop and sit back and look at what this person would want and how we can manage their care most appropriately. Are we going to fix it? Are we going to make it better? Are we going to make them better? Are we going to fix the underlying condition? Possibly not. How do we focus on the rest of that care? That's how an advanced care plan can help us do those things.
To be organised and to have everything in place does totally put your mind at peace. I feel for me, it's been a huge journey, what I've gone through. A huge journey. I wouldn't change anything. It's been, I think, what the path that Mum has had to go down is what I've had to go down, and from it I have learned a huge amount about life. And I think by having the advanced plan is making me very prepared for Mum going and very at peace with her going. I feel it's sort of all organised, and I can just now enjoy the time that I have with Mum, and that's coming out here and spending really good quality time with her. And there isn't something in the back of my mind saying unanswered questions or nothing's resolved. 7 years ago, not that long ago. That was at the opening of Crave Wares, remember? Remember that? You still look beautiful. You both look rather good, I think. I think it was one of our best photos. And look at the album. Let's have a look.
If I could encourage anyone, it would be for families, don't wait, don't put it off. Think about it now. There's never the right time to have this discussion, so it has to be now. It's got to be around the kitchen table. Get the help in that you need, whether that's your GP or specialist or other health professionals. Get down and start talking about this, because it's a really important thing, and that way we can help you look after the person in providing their care.